We are back from the OntarioMD Conference, and we did 8 panels and interviews across the 2 days, welcoming 20 panelists across disciplines to bring their perspective at why they come to the OntarioMD Conference, what aspect of digital health transformation are they most passionate about, and what barriers do they encounter when trying to adopt new technologies on the front lines. It's an amazing time, and DHC 2025 captured that energy and brought a lot of people along with it. So please enjoy. It's a best of compilation from the 2 days of panels and discussions that we had in the exhibition at DHC 2025. First up, we have Dr. AJ Kadhim-Saleh, family physician and the co-founder of Pippin AI. Dr. Pouria Sadeghi, family physician and CEO of Canada Clinics, and Alitta Tait, CEO of Cherry Health. What are you most passionate about in digital health transformation?
In digital health transformation?
Yes.
I think 2 things, if I may. One is making it easy for physicians to do their job, and for efficiencies to be maximized so that we can solve this problem of not having enough doctors for patients. I think we have enough doctors. I think the doctors are just not empowered to do their job as efficiently as possible. So I don't think we need to go as far as, thinking about 12 years down the road, how are we going to, bring in new medical schools and train more doctors, more residency. I think it's a lot easier than that. I think if we apply technology properly, we can have enough doctors for everyone who's missing a family doctor in Canada. We just have to empower our doctors to see more than 12 to 1,400 have a panel of more than 1,200 to 1,400 patients. I think they used to have 2,000 to 3,000 when we were on paper. Why is it that we're, working so inefficiently? Because the technology is not helping us. The technology is actually somewhat hindering us. I think things like the AI scribes that are coming in are the tip of the iceberg of what's to come with the help that we can get for our doctors to be more efficient and solve this problem a much easier and faster way than training more doctors. We should still do that, but we can get really close to a solution right now if we have that right platform that can do that for doctors.
I'm really excited for a talent management type system that actually allows people to connect effectively, but also so that they're well utilized, right? So that they're actually working to their full potential instead of waiting for that next locum to come up or find it haphazardly. Let's get the next thing lined up so that they're actually practicing to their full potential and using that time. And then for Jane Philpott and these others who are really focusing on how do we create a primary healthcare system that works, how do we do that? I'm excited how digital transformation can help to get more workforce analytics, better planning and future planning for that, because we don't have much visibility into how many open doctor jobs there are in primary care. Each clinic is managing this themselves. And there is no one central place that actually effectively shows how many jobs are open, what are they, locum, permanent, who's ready to retire, who's burning out. Like, we don't have transparency into that as a system, and that's something we're really passionate about, is building those types of analytics and that transparency and that collaborative approach to the system. So I'm really excited about that. I think that's going to make some big changes in the way that primary care is supported and that governments can plan ahead, whether we do need more schools, whether we do need more international physicians and practitioners, whether we do need to get pharmacists maybe doing a bit more, whatever that looks like. How can we actually utilize the practitioners that exist to the most of their extent and have visibility into that?
Yeah, absolutely. And you think about physician time being incredibly valuable, and I'm seeing how doctors are spending a lot of time just doing things that are tedious. We don't like to do them, but they're part of our work, and it's tedious. This is I train to actually talk to patients, diagnose, provide treatment options, counsel them. I didn't want to train to just sit in front of the computer and type away. I'll tell you, like, one of the big challenges that I'm seeing in my own practice is this inbox management.
Yeah.
I'm getting 60 to 100 messages every day that take me 2-3 hours to like clear, at least, right? And it's like, that's like another, part-time job for somebody else, like, doing this, and it's unpaid, and it's just crazy to think like some of us, like as physicians, like we've trained for 12 plus years to like actually become a licensed physician, only to be spending like, a third of my time doing paperwork. That's crazy.
So I absolutely agree with what you said. I think that you touched on it, because we've partially or mostly solved the problem of typing away after your appointment, so with the scribe and all of that. But the next pain point for all of us, the inbox management, how it's going to be solved with our AI agents, AI tools, and connected all together, because if we're using a bunch of different systems and you have to click in and out and somewhat, it still becomes inefficient. So I think we have a lot of stuff to solve, and it's exciting because it's innovation, and it's actually impactful innovation. It's not innovation for sake of innovation.
I agree, and I think this type of conference is so critically important, because as these things get built, how do we inform practitioners effectively that it exists? And how do we roll them out? And OntarioMD does a really good job of that by having, with the scribe tools and things like that, having these programs. Not every province has that. And I think a lot of provinces, especially if you're rural, you're maybe not attending the conferences all the time. You're the only doctor. In a really rural setting, coming to a conference like this isn't always feasible. And so I think as these things get created, another opportunity, and a critical one, is how do we actually effectively roll them out?
Next, we have Dr. Timothy Kodsi, family physician and the founder of Mimico Medical, and Dr. Dane Wanniarachige, family physician and the co-founder of Okhowat.
7 years ago, I founded a clinic called Mimico Medical. We started as just me and 2 staff, and now we're a multidisciplinary medical center across 2 sites and growing. I believe in a culture of care that involves patients, admin, and physicians, providers alike. And that's the way we need to move forward in healthcare. And as you'll see, as we continue to talk with Dr. Wanniarachige, Dr. Dane, you'll see that our values really line up here. So,
absolutely, man. Thanks. So my name's Dane. I'm Dane Wanniarachige. I'm a family doctor. I have my own practice in Etobicoke. Every Tuesdays, I work at a homeless shelter doing primary care. And every other Thursday, I work at a retirement home. So I kind of see the whole span of primary care on the front lines, first line. Before medicine, I worked as a journalist. I did a master's degree in journalism. I wrote for the Canadian Medical Association Journal. I've done podcasts, created audio documentaries about preventive care, primary care, the healthcare system. I'm passionate about that, about improving the system, which has a lot of gaps, is very archaic, has a lot of holes in it, and as a result, unfortunately, patients and physicians are drowning in this, right? And so that's why we created the product that we're creating. But that's my background.
So, thank you. Why do you love this conference?
So I think this conference is a good way to connect with other people doing digital innovation, right? Other people who have identified the same gaps that we've identified, and seeing how we can collaborate. I've talked to, I've lost track of how many people we've talked to in terms of building connections on the API side, the front end side, doctors, clinicians, owners, insurance companies. All of us have pretty common goals of trying to solve this primary care gap, and so this conference is a great toe in to connect with these people.
Yeah, and I think one of the most fun things of what we do, and we alluded to this earlier, is the relationships, the connections you make, the networks you build. So being able to come out here and see faces and names that I've been working with for years, and also for us to see what else is out there, who else is in the digital space in Ontario, is really important for us, not just as providers, but for us to be able to keep filling in those gaps. So obviously in Ontario, if you want to know what's going on in the digital front, this would be the conference to come to. No question.
What's the domain that you're most passionate about?
I'll just quickly answer because I think it's really important to emphasize, Dr. Dane, our emphasis on patient-centered digital solutions. And I think that's really what our focus is with Actual. A lot of what we see in this conference is focused, directed more towards physicians, providers, administrators. But again, if we're going to create an ecosystem of care that's well-rounded, then we need to educate and empower patients more with digital tools. Right. And so I think that's my biggest focus.
Absolutely. I think it's the patient experience is what we're focusing on. While others are working on the back end, we want to say, hey, the patient experience is archaic, it's old. We use snail mail, we use faxes to communicate with people. Why not bring that to an app? We do everything else on apps, banking, communication. Why not bring primary care into that field? And we think that there can be a point of integration where when you want to access the greater sphere of primary care, which is mental health experts, physiotherapists, doctors, long-term care, you should be able to do that from an app, and the patients should be accessible to patients through digitization.
Next up, we have Adam Sinai, Director, CHN, Eastern and Western Canada, QHR Technologies.
Hello, everybody. I'm Adam Sinai. I'm a Director with QHR for Eastern and Western Canada for what we call our connected healthcare networks. So I manage an amazing team of EMR experts in sales and client retention on the outside areas. So I have another colleague who's a director for the middle provinces, and I manage Ontario, Nova Scotia, and BC. And I've been with QHR for 14 plus years and in the healthcare space for just over 18.
Cool. Why do you love this conference?
I love this conference because I get to see people in person, number one. So not just some of my colleagues. I'm now based in British Columbia, right. So I get to see some of colleagues who I don't get to see all the time.
Yeah.
I also get to see clients. So before I was a director, I was selling EMR. So there's people who've been, who I've known for these 14 or 10 plus years. Okay. And it's just great to connect and see people. And that's really the best part.
Awesome.
And of course, to see the new vendors and the different exciting new things, definitely around what this whole conference is about is to learn and meet new people.
How many OntarioMD conferences have you been to, I should ask?
So 14, there's used to be at least once, or, we're getting to 14, at least call it 14.
For sure. Okay, so that's awesome. So have you noticed anything that's changed in any trend over, is it obviously the technology changes, the clothes change, the hairstyles change?
Well, it started as the Wild West, right? So we got in when the OntarioMD, when the first initial EMR funding was happening. So that was a really exciting time where it was mass onboarding of doctors and clinicians who were paper-based. And that was just wild. And it was like pioneering at the time. And how it's evolved is just continue to see the growth of the industry because we are pioneers. It's not everything is, the size of the databases are much bigger. There's no historical precedent to where we are, so there's learning on the fly. So you're on the train and it's moving and you're trying to continue to learn. And then how can we make things better? And I work with provincial ministries and I work with hospitals and know a lot of physicians, and I'm lucky to, or sometimes unlucky to understand the underbelly of Canada's healthcare, and you just want to really make as positive an impact as we can because people are stretched, and especially now in today's climate, we want to make a positive difference in lives, and we want, especially with our clients, to utilize all the tools in the toolbox and just become more efficient because time has become the most precious commodity. Of course, with financials. There's been a lot of consolidation in the market because just the cost of running a business, and you're seeing a lot of consolidation because people don't necessarily want to have leases and the responsibility and staff and things like that.
You're giving a presentation at 2:30.
Yeah.
What's that presentation?
So the presentation is around beyond burnout. So we want to help our clients, and we want to help them become more efficient, but it's not just on the EMR vendors. A lot of it has to do with our clients making the time to learn. So they are keeping up with the updates in the actual platform, to taking advantage of the services. We have practice consultants, so we have a whole team of Accuro experts, and we provide this incredible service at no charge. And they're able to connect with clients and look at their workflows and look at the way they do things and provide education on the tips and tricks and best practices. And it really, sometimes it could be the smallest thing, could make such a big impact, and that could save half an hour a week or an hour a week. And so, and not everyone is taking advantage of such a great service that we provide. And then it's also being aware of all the addition, we have a marketplace of new vendors and products, and it's growing. And so, but it takes time to learn and to evaluate, and this is the thing, is sometimes, so we want to let people know, are you taking advantage of the tools in the toolbox? Yes. Are you up to date on the learnings of the product? Have you engaged with your practice consultants? Yeah. And are you aware of all the products that are available?
Next we have Dr. Ali Okhowat, family physician and co-founder of Aya Health Technologies, and Dr. Hanmu Yan, urologist and founder of Translational AI.
So, would you like to start? Yeah.
My name is Hanmu Yan. I'm a urologist in Toronto, and I'm excited to be here to see my good friend Ali, who I've always looked up to. It's great to be here. Thank you.
And the talk that you were presenting?
The talk. Well, I came to speak about a physician referral summarizer. That's what I've been plowing my energy into over the past year and a half, just to make my own clinics bearable and survivable. So yeah, I came to show a informal QA of what I found over the past few months. Yep.
Awesome. And hi everyone, my name's Ali. I'm a family physician from BC and flew all the way here for a few meetings, and I'm taking the tail end of my trip to join the conference. I'm a practicing family physician and also the co-founder of Aya Health Technologies, where we create technology at the intersection of medicine and digital health. And on my end, I've been going to a lot of these big international conferences where there's thousands of people from, tens or like hundreds of countries. And I think the beauty of this conference is that you see health tech is local. It's a local endeavor, unless if you understand very well the nuances of the problems that patients and providers have locally, you can't implement really good solutions, right? And just having that ability to connect with founders, with users, with patients and providers here in a very more intimate setting, I think it's really powerful. We got to bring something like this to BC or Western Canada for sure.
Well, so for example, for cloud providers, if you're a coder and you want to access an LLM, it's actually very expensive to spin up your own GPU. And there's even to try to get inference, Google, Microsoft, it could be made a lot easier, and we should be given more choices. Like right now, if you want to build on the big cloud servers, you really have one model or two that you can use, whereas, the Americans have so much choice. So I see a very limited marketplace here, and it should be bigger.
Mm. And let me take a completely different spin on barriers, and I'll talk about what are the barriers just in terms of using the technology. I would say it comes down to trust. And there's a lot of different aspects to that. There's the transparency or the black box nature of AI. There's the aspects of safety that are paramount. But I think you can distill those all down to trust. And whether you're a provider who's interfacing with it and it's a co-pilot, or if you're a patient and you're asking questions, like there was a great demo on voice AI in the talk before this. The big question is, how can I trust that what I'm hearing, what I'm seeing, what I'm receiving as the output of this supposedly wonderfully brilliant system is correct? and I think we're going to have a lot of leaps that are going to be technological leaps that are going to be coming down as they have over the past few months and years, and it's going to continue. And it's going to be leaps that are going to be done ahead of the trust that is available between providers and patients and the tools that are going to be that we're going to be encountering in the wild.
Yeah. Well, I mean, that was an issue that came up in the session I was just in. And I think it's really important that as AI users, if you're going to be a clinician using it, either receiving AI output or generating AI output, there's a huge responsibility that you have to be the human that approves or disapproves of the outputs. And we have to take that job seriously. If you start, if you look at your AI generated scribe note and you just give it a pass without reviewing it, you're sending potentially wrong information into the ether and it could get propagated. And likewise, when you're receiving information, you also have to really ask yourself, is this correct before you continue to propagate it along? So there's individual responsibility. And then on the coding side, it's about using the best tools that we have, internally consistent, provenance provided code that already does a lot of the internal checks before you even generate anything AI. So I think there's a huge responsibility, and with great power, this is my Spider-Man moment, comes great responsibility.
Got to get the Spider-Man quote in there. That's great. Just on that note, not to go on a tangent, but I was at a talk recently on autonomous prescription. Just, it's fascinating to look at what's happening in something like self-driving cars and the standards that we have there and the different levels of autonomy. Healthcare, I think most people feel, is distinctly different, but there are some very interesting similarities when you think about the different levels of autonomy in self-driving versus an end-to-end patient experience in healthcare, and what are the things that are needed for a situation where somebody would interact end-to-end autonomously with an AI agent.
It's the capabilities have totally exploded over the past number of months. In terms of one time I sent Ali a text. I said Ali, you don't have to hire any more programmers because programming's solved. I'm backtracking on that because it's not solved. When you're trying to add in a feature, it's really hard, but it's so much easier than it was a year ago. So much easier.
Yeah, or at least to get your idea out there, to say this is what I'm thinking of.
Yeah.
Right. To build that initial prototype. Yeah, for sure.
So, what's the biggest thing stopping us from implementing new tools in our business, whether it be voice AI? You were just
Let me bring one framework or way to think about this, right? In terms of barriers of adoption, right? So let's take a typical curve and let's divide up the personas of what type of people are taking up technological adoptions. We have one group which is the bleeding edge, tech forward, early adopters. Okay. We have another group that's going to be the majority of people who are, let's call them the mainstreamers, right? The ones who will adopt something once it's trusted enough and all the kinks have been ironed out. Then we have the last group, which I'll call the Luddites, right? The ones who will, kicking and screaming, you got to rip their paper charts out of their hands before they'll go digital, okay? So let's break those up, those three personas. For the first one, the tech-forward people, I think the main barrier is just does this feel like magic for me, right? I'm excited by technology. I want to put it in anywhere that I can. And for the Luddites, I think the big barrier is I don't want to change what I'm doing because it works, right? There's no way I want to do anything different because I trust my process. Whatever the solutions that you come up with to break down those barriers on both sides, giving people the feeling of magic or making people trust the process so much to say that you're not giving something up, you're only going to be solving for like 2 standard, 3 standard deviations away from the vast majority of people who are the mainstreamers. So what do mainstreamers care about? I think it comes back to the transparency and trust, right? They care about, is what I'm using trusted, and is it safe? And there was just a report this morning that the fastest growing companies, you know which sector they're in? The fastest growing AI companies? Evaluations.
Evaluations, okay.
Because it gets back to this question of, if I'm operating in an expert domain, how can I trust that what I'm using is actually legitimate? And the only way you can do that, we're going to see 2025 and I think the early 2026 as the scale AIs, but in the very specific niche domains, just accelerating like crazy, because you need experts to come in and label or categorize data before we can understand, if you have an agent running through this process, is it safe?
Right.
So on a technical level or a business model level, I think the biggest barrier to adoption is going to be getting quality evaluations in place, and that's going to be nowhere more true than in healthcare. That's my prediction for 2026.
That's such a great answer.
Yeah, I mean, for me, I think it's about internally building something that is deterministic, that is not stochastic and not random. So it's kind of like bringing back some more traditional tools. You know, a chatbot isn't the solve for, you know, all types of problems. Sometimes it's actually like an algorithm that you take someone down. You can code the algorithm with code. You can use AI to make that algorithm, but once it's been thoroughly vetted and you can trust that the outputs are going to be the same every time, that's going to increase trust, right? I think I saw there's something about Mira Murati's new startup. She's
thinking machines.
Yeah, they're looking at manipulating kernels so that more than just temperature, that you can actually get the language model to give you deterministic outputs. So we really need to, I think determinism rather than generative ability is what we need in healthcare. Because we're not here to, you know, write songs or do marketing copy, you know, so.
It's okay to have hobbies and that's the main stuff if you want, right?
Yeah.
Okay, so could you define determinism, please?
Determinism is if you go through the same steps, you get the same answers every single time. It's actually what all traditional tools are meant to do. Like, you know, in medicine we had these the era of nomograms, right? Like, you know, it's an old-timey tool. Like, everything is scored a certain number, and if you line them up, you're always going to get the same score, right? If you're looking at a clinical risk calculator, it's always going to say you have the same risk. It's not going to sometimes say you have that risk or sometimes this risk.
Okay, I understand.
Next, we have Dr. Pavel Antiperovitch, cardiologist and co-founder of QuickChart, Michael Yingbull, professor of computer science at Conestoga College, and Marc Faktor, director of sales, TELUS Health.
Awesome. Yeah, Marc Faktor, pleasure to be here. Long background in digital health and patient engagement. Currently working with TELUS Health, director of sales for our EMR portfolio across the nation minus Quebec. Pleasure to be here.
Hi there, my name's Michael Yingbull. I'm a professor of computer science at Conestoga College and married to medicine. My wife has a clinic and I look after IT for it, and I really enjoy, you know, exploring things from being there with her, but also on the academic side of what I could explore there as well with the students.
And my name is Pavel Antiperovitch. I'm a heart rhythm cardiologist from London, Ontario. And my background is software development. I'm a software developer for the last 2 decades, mostly EMR, medical record systems. I was originally involved with Oscar. And quite recently we started a medical startup to help physicians with a documentation burden, so called QuickChart. I just finished my training as a cardiologist, and I do arrhythmia as my primary focus of practice. And this is my first one as a fully trained physician. So thank you. So it's very nice to come here and to connect with all my colleagues that I haven't seen in a long time, and to see what's new in the medical technology world. So, and also to speak with other specialties of family doctors to see what challenges they face. And as somebody who's interested in software development, and to see how can we use technology to help address those challenges. So very exciting conference. Yeah.
Well, for me, what I really like about this is just connecting with other people that have, problems or ideas, about what needs to be done. I'm really enjoying the energy I'm getting from a lot of the clinicians because there's, I think the AI piece that we have, which is certainly an area of interest for me, has certainly, I think there's concern, but I think also probably a fair amount of hope of what that could do if done right. It's not something that we've been talking about for 10 or 20 years and not getting correct or not feeling like it's been advancing the way it should. So I think there's a lot of energy of where this could go, and I really enjoy a lot of work at the grassroots. I sort of grew up with the internet. I watched it come. I'm a Linux hacker and open source at nature, and what that really has always brought an appreciation for me is collaboration. That real sort of co-development of people that want something working together to do it. So that sort of, hey, let's work together and solve problems. What can we do? What can I do? I think there's a real cool energy here with that I'm enjoying chatting with people about.
Marc, what do you got? What area of digital health transformation are you jazzed about right now?
Yeah, I think the AI revolution is there. It's here, right?
Yeah.
So, how we're applying this to practice in a responsible framework, how we're looking to combat, the burnout that physicians have, how we're looking to combat the shortage of physicians, how we're looking to augment individuals' roles and expand their scope of practice is very interesting to me. Also the needs of our clients and our prospects are top of mind for me at these events, right? So what are people having trouble with? What can we help them fix? What are people wanting to spread and scale, and how can we be a stimulus to that? This is a great opportunity to have FaceTime with the people that use our technology and be able to learn from them in improving that use case and also spreading it across other jurisdictions as well. I'm very passionate about what we've done and readied ourselves for at TELUS Health with our infrastructure, our AI factories, our partnerships with Canadian sovereign AI vendors, and being able to do something at scale in a responsible private Canadian framework. So how can we then lean on, the initial benefits and infrastructure, moved from generative to agentic, and have the solution become a true co-pilot to the clinician, and then work with our clinicians to be able to embrace that and bring it to market at scale in a responsible manner.
Next we have Mei Chen, CEO of Free the Agents, Kino Song, co-founder of Medium AI, and Cody Reeves, Director of Growth and Partnerships at Cherry Health. I'll let you articulate it, but you can book an appointment with your doctor or healthcare clinic, and you can do that without speaking to any person, and that will get integrated with the EMR. Is that the idea?
Goes way beyond that.
Okay,
it goes
please.
way beyond
Go
just
ahead, Mei.
appointment booking.
Foundationally.
It's foundational. It's like your whole healthcare journey of before you get to the clinic, while you're at the clinic, and after the clinic. And before the clinic, a lot of these tools can help you just get the information you want. Should I go into a clinic fasted? How much water should I, drink before my MRI test? These are important questions that maybe patients are not educated on before they get to a clinic, and then you're wasting a lot of medical resource if they don't come in prepared. So that's just one aspect. Like, how do you find programs? How do you find, a home care service? All these, I think these are Googleable things, but you can use agents to give you the exact answer, serve it up to you on a silver platter. Why not? During the clinic, you have your scribes and you have your translators, and then post-clinic, you can have the patient go home with a pamphlet have that pamphlet be an AI pamphlet. Now you can talk to that pamphlet and you can really get the, let's say, hypertension medication. How often should I take it? You know, you can Google it, but maybe it's not for you. But to have something that's specialized for you and maybe even in your own language. So if you didn't know, ChatGPT can speak 58 languages. Officially, it can speak 58. Unofficially, like 80 something. But and you can really cater using that and can package your pamphlet into 53 languages. That will cover a wide spectrum of patients.
Wow. Yeah, Mei pretty much summary everything from the very beginning to the end. That's a really long journey. So you can tell, like for this entire healthcare systems, there's so much things could be done to really automate and improving the efficiency, improving the patient care quality, their care outcome. But then from our perspective, like I totally agree with each individual aspect you just shared right now. Including the triaging part, including the education part, then the discharge after the patient, like how many hypertension medications should I take? All of them is so critical for both the clinical team to deliver information, but also for the patient to receive the care. But then our focus, like throughout the past half year of experience, we see a strong challenge of actually integrating all those innovative solutions into the current healthcare systems. So we spend a lot of efforts looking into the technology side and the administration side to see how we can use the most approachable and accessible way to allowing healthcare team and the patient to receive these supports ASAP. So what we do is we start with what you said, appointment booking. It seems very easy, but there are still a lot of technical challenges that we polished to the very efficient way to providing this quick booking, quick availability search for the patients. So it provides this direct time saving and cost saving for the both clinical side and for the patient side. They can, especially for the elder, speaking different languages. Right now we have Mandarin speaking patients, Filipino speaking patients using our system to book appointment directly into EMR. So that's actually start to providing a very straightforward solutions for the patients. And then I strongly agree with the post-discharge part, because I see administration is helping the clinical team to save some money, there are direct incentives, but what we want to, from the healthcare industry, what we want to see is somehow probably from legislation level or from the hospital level, to come up a incentive plan that allowing someone to pay for the post-discharge plan, because we have public healthcare systems. Right now, we don't see a very clear path that we develop systems for the post-discharge when the patient returns home. Who is gonna pay for this continuous care monitoring using voice or using all kinds of innovative solutions? Because hospital and care center, they don't have a direct incentive to care the patients afterwards. So it's gonna be an interesting question, from the healthcare. I want to listen about your idea, what's the business model maybe in the future for patient, who is paying, who is getting, because patient is getting benefits. Yep. But clinical team doesn't incentivize by the benefits. Yeah, that's something maybe we could consider about. Yeah.
Definitely curious.
It's a big question.
That's a big question.
Who's going to pay for it?
It's always who's going to pay.
Yeah.
So, and specifically, Kino, you mean there's a lot of different use cases and applications and examples, but this one is when patient leaves the hospital. There is education and empowerment tools that could be helpful, and there's no remuneration in our healthcare system to care for people once they've left the hospital.
Limited. I'll say limited.
Limited. Okay.
There are several programs that are providing continuous care, but relatively limited.
Okay.
Yeah.
So this conference, why this conference? Why don't we start with Cody, who comes from across Canada, from Calgary, from Cherry Health. So why do you guys come to this one? What do you like?
We flew in OntarioMD right now. Ontario as a whole in terms of our user base, in terms of who we have on our platform. I think Ontario, just by sheer size and population, is the largest, and that's the largest that we have. We're from Alberta, so that's our second largest spot, and Western Canada is where we grew a foothold. Ontario is great because it brings our OntarioMD, and this conference itself is great because it brings the right type of audience that we're looking for. So it brings the physicians that are looking, or maybe those clinic owners that have showed up, have had issues hiring in the past, or they're opening new clinics and they're like, I need nurses, physicians, MOAs, all different types of practices that we can help with. But it also brings another thing that we try to do at Cherry Health, as mentioned, is bring those relevant services and up and coming products that are available to these clinics to help solve their problems. Because sometimes it is a people problem in terms of having people come in and be that front desk, and we have so many patients coming in, we can't cover it. But maybe there's a different tool out there that can support, and whether it be in the short term or the long term, that they're simply not aware of. So we're able to connect with the entire ecosystem in a relatively manageable size. It's not this massive global conference that we can do, and we can have really personal sit-down conversations like this, engage in conversations like this, and be able to really just show our value. We're a startup as well. We've only been around for 4.5, 5 years. So it's important for us to really engage at a ground level, boots on the ground, understand what these founders or clinic owners or physicians are really looking for and what their challenges are. This gives us a really great opportunity and platform to do that, and that's why we fly all the way over here for it. So,
next we have Dr. Ira Bernstein, family physician, Josh Miller, primary care practice consultant at Dr. Kit, and Jeevan Singh, CEO of PocketMD.
There's a gentleman, Paul Casey of Oscar Pro. He's leading a discussion on kind of like the healthcare clinic of the future, which is kind of sponsored by WellStar, which is like the technology division of Well Health. But it's basically, can a physician walk into a clinic and have all the tools and resources at their disposal to make sure that they're well supported, to refrain from any burnout. But yeah, just feel like they can walk in somewhere and just kind of start working from day one and have everything ready for them. And to echo Dr. Bernstein's remarks, also interested in the AI. Scribe has always has been like the name of the game for recently, but interested to see how that now develops into clinical decision support, and just how the next phases of AI and how that will progress.
Explain what Dr. Care is, and
Sure.
then how is AI, or is it a part of Dr. Care?
Yeah, so Dr. Care uses analytics and technology and data to help doctors uncover actionable revenue opportunities within their practice. So not having them work harder, but work smarter for the work and time that they're doing. In terms of AI, so the AI scribe that's kind of embedded within our network is called Nexus AI. I believe all Oscar users have access to that if they use Oscar as their preferred EMR. But also, we are constantly building proprietary technology and machine learning that can automate certain processes within a doctor's practice, whether it's error corrections or billing certain incentives or premiums. With the new Full Plus model coming down the pipeline in a couple months, there's going to be the introduction of a couple new revenue streams and compensations that we look to help doctors kind of capitalize on that. So that's how we use AI and machine learning in our processes that ultimately help doctors make more money, save more time, practice more efficiently.
Interesting. So billing optimization and tools to, I guess, improve.
Exactly.
that area.
Billing and revenue optimization. That's where we excel with any doctor of any patient enrollment model.
Dr. Bernstein, so there are a lot of tools here, right? And I am astonished by, in 1 year, how far the same tools have come. The same people, the same companies. It's quite remarkable, the delta in this particular year, is my observation. So the tools are great. So what is the barrier on the front lines? what's the barrier to implementing some of this stuff?
Great question. What I'm finding is a lot of physicians suffer from some sort of inertia, resistance to change, and implementation of newer technologies that are coming at a very rapid pace. I've always seen myself sort of at the forefront of technology and being an early adopter of systems that can help me improve my practice. At the same time, I see some of my colleagues that are still on paper charts and are not using any of these tools, and I'm thinking, why wouldn't one want to implement this? I mean, everyone has their own reasons. There may be costs, there may be a learning curve, distrust of technology, all sorts of things, and perhaps being overworked with clinical care and not seeing the light that's right in front of them to help them. I see myself as seeing that light and adopting those tools that will help me with my practice and reduce the burnout that I think frontline physicians, particularly family physicians, have been having trouble with. There are a lot of problems in our systems in healthcare in Canada, particularly things that we can't control. So these sorts of systems here, the technologies, are things that I can implement, that I can control to make my life better, and that's what I like.
Jeevan, thank you. From your perspective, what's the biggest barrier to someone adopting a advanced, new age, user-friendly software, because they're here? Tools are here.
Part of it is inertia, right? Part of it is the juice worth the squeeze, right? There's a lot of there'll be a lot of products out there that can create some value, but actually implementing them in your workflow will cost you a lot more time than it takes than it will save you, right? So I think any technology vendor that wants to go into like a legacy market and do some brownfield development, you have to be able to make sure that the change management taken care of, and at the end the output's worth it, right? And if you can make that happen, then the inertia kind of goes away. I think doctors and people in general are reasonable, logical people. If you tell somebody, hey, I'll save you 8 hours a day, it's going to cost you like a 40-hour upfront cost to kind of migrate and think through things, I think that cost is worth it, right? So just to define what the cost is going to be of that lift, of that of that change management, and what the end product and the end result is of that change management.
Next, we have Stephanie Stamatakis, Director of Customer Engagement and Partnership Success at Dynacare Insurance. Dr. Joel Moktar, orthopedic surgeon and co-founder of QuickChart. And Dr. Paul Cano, family physician and OntarioMD peer leader.
You've been someone who's embraced technology right from the start of your career.
Yep.
What has been the biggest barrier to adopting technology in your practice?
Probably the disjointed healthcare system. So the example for my own practice, on one day I use a Curo, in the hospital I use Meditech Expanse, which is their EMR. I run a virtual clinic where I use TELUS's platform, and I work in another clinic where they use a really fancy EMR called Microsoft Word. So it's all over the map. There's multiple different systems. I know you'd mentioned this before, but this is the challenge, is that the healthcare system itself is so broken. I know some provinces have a provincial EMR. I think PEI has this. Something along those lines would go a long way to help, because if you think about it, the same patient is being registered in all of those different systems. And then my billing software is a fifth system that we're registering the same patient in again and again and again. So there is no unified solution in Ontario. It would be great if we could move in that direction. That's why we see all these different solutions. But the pro to this is you get smaller companies that can innovate quickly in the space because there is room for that.
So we're all here. We invested our time and our resources, and we came here for a reason. So what do you love about this conference? Paul, why don't we start with you?
What I love is it just gives you ideas for how you can improve your day and your practice with technology and with some of the people that you meet. The networking and is fantastic. There are some of my peeps that I hang out with, and that's good.
Does that resonate for anyone else?
Yeah, I agree. I mean, there's the networking aspect of it, but I love seeing the different companies. Many of them are physician founded, and just seeing all the different niches within the healthcare space where true innovation is happening. Many companies are Canadian, many companies based in Ontario, so it's great.
Yeah, so I would echo the networking piece for sure. I think the important piece for us is really just hearing from physicians one-on-one in an informal session about what their needs are. Dynacare Insurance Solutions are looking for ways to try to automate in our spaces and make things easier for physicians, and rather than trying to guess what that looks like, a big part of why we're here today, and it's the first time Dynacare is at this conference, is really to have physicians tell us where we're not serving them in the process and how we can do better. But also great to see Ontario-based organizations that are really focused on physician needs, especially around health tech.
What area of digital health, might want to use this, what area of digital health transformation are you most passionate about? Dr. Moktar?
Well, one of which is coming up at 1 p.m., I believe there's a talk on standardizing the e-referral system for specialists, because the referrals that come into us are all over the map, sometimes handwritten on the back of a prescription, sometimes they're PDFs, sometimes they're faxes, sometimes it's through Ocean. So one streamlined system for our referrals would be great. We're looking at developing a solution to this, but there's lots of other vendors that are in this space. So I'm curious to see what the speaker is saying this afternoon.
Does anyone have any questions? Because referrals is a big thing. So, are you streamlining? You're an orthopedic surgeon.
Yeah.
Right? So are you streamlining the receiving of the referrals or the sending, or is it the same thing?
It's mainly the receiving them. So we get a lot into our inbox. It requires a manual review. Yeah. My assistant has to enter the patient data manually, all the demographics. Then we review the referral, the information, the history, the imaging. There's a whole package that comes for every patient, and the format is different for every referral. So it requires a lot of hours of my time and her time to go through these referrals and triage them appropriately. So I think a solution in that field is definitely needed.
Is it a tech solution? Is it a quality information solution? What do you think? Is it both?
I think it would be a tech solution to start with, like something that can just digitize the information right off the get-go. A lot of faxes are now digitized, so coming in like SR Fax at Unite, but there is still some paper referrals that come in as well. So something that can digitize everything and display the data in a text format or digital format rather than a PDF fax format.
Paul, what area of digital health are you most passionate about right now?
For me, it's the reduction of administrative burden on primary care, particularly comprehensive primary care. You know, I'm kind of fading out in primary care at the end of my career, and not seeing folks take up that job that I have loved, and for good reasons for some of the things. So I'm very passionate about reducing that administrative burden, whether it being easier referrals through e-referral, whether it being scribes, whether it being AI automation of a bunch of repetitive clerical tasks that we've got to do, whether it be, and then beyond that, regulation that says, you know, this form has to be done by a physician versus, which sucks up our time and sucks the life out of us.
What's the biggest barrier to that adoption?
So I think there's a lot of different perspective, right? You can ask the question 100 different times and get 100 different answers of what a perfect world looks like, and really finding a way to collect all that feedback and unify it in a way that it works for all. Surprisingly enough, we've done surveys in the past to very targeted groups, but that actually would argue that they prefer fax as an engine of communication, whereas some of the physicians who would attend a session that's kind of tech-based in nature would probably have a different form of opinion on that processes. So it's really just making sure that we're not fixing a solution to some physicians that may not be broken, but also really evolving and helping integrate solutions that will work long term and facilitate the administrative tasks for everyone involved. So I think that would be the biggest kind of roadblock. The other thing is really just adoption. So, as great as tech can be, it can be very scary. Change can be scary sometimes, and some of these evolutions can be scary. So helping people adopt and really see what's in it for them once we do form a solution is probably one of the things that would come as a roadblock or a need for enhancement.
I'm going to throw it maybe over to you, Paul. How did you phrase it? Getting them open to
Adoption? Yeah.
Because as a peer leader, that's something that you focus on.
Right.
Do you encounter hesitancy, or by the time that you are with a clinician, they've already passed that?
No, there's definitely hesitancy because of our tools and solutions are often very disconnected or that their own thing. So for instance, at the start of my day, I love using a scribe, I love using electronic prescribing, and I love using, if records haven't been ended up in my EMR because we're a bit disconnected. I love going on to, website portals such as Connecting Ontario or Clinical Connect to grab it. But all four of those things require a separate login and appropriately two-factor authentication. We got to make sure it's security. But boy, so therefore, when you're selling this to other physicians, oh yeah, it's another login. Forget it. That's one barrier, or it's another set of things that I've got to review this document that's 10 pages and legally. And I know somebody's vetted it, great, but still, like that's we gotta unify that, so that we're doing it in one process when we onboard physicians and clinicians, in Ontario for whatever role we take.
So it can feel it could feel overwhelming for someone to take on something new because of there's no single sign-on, or that's elusive, or long legal agreements. Is what I'm hearing.
And even when it's like an example we heard today, we're so busy putting out fires that we don't want to take the time to install that sprinkler system because of all you got to do to install the sprinkler system.
It's hard. It's a hard problem. Yeah. How do we solve the time problem, guys?
That's a good one.
I mean, the big thing that we see is that physicians trust each other to a high degree. And if you have one physician champion who has figured out a certain tool and he's spreading it to their colleague and their network, that's how growth and how change happens. So it's good to see OntarioMD identifying those key peer leaders for that growth of this technology.
Okay, that's it for our special DHC 2025 episode. It was a true pleasure to be a part of, to get to meet each one of the panelists and so many more of you at the conference. Thank you so much to OntarioMD. We hope you enjoyed this very special episode. Our next two roundtables are filming in October and are on Faux Plus and providing a window into the new TMU Medical School. We'll see you then.